3, 2, 1. We are live now. You can start.
Good afternoon, good evening, good morning to everyone. A very warm welcome to all present here, respected panelists, moderators, and all the participants. A special thanks to our keynote speaker, Dr. Michael Fehlings. It's an honor to be graced by the presence of such an accomplished neurosurgeon and author. We have day 2 activity, which will be done at the end, and we will announce the winner. So please stay with us. We have among us Dr. H.S. Chabra, who is Chief of Spine Services and Medical Director, Indian Spinal Injury Center, New Delhi. And he is also Editor-in-Chief of Journal of JCOT. He is immediate past president of ISCOS and SE. He is a Vice President of Association of National Board Accreditation Institute, Executive Member of Asian Spinal Cord Networks. He is a chair of Spinal Trauma Study Group of International Spinal Cord Society. He is a member of Advisory Committee of Stem Cell Experts from ICMR, CDSO. He is an editor-in-chief of ISCOS textbooks, e-learning, a web resource of ISCOS publication. He has more than 145 peer-reviewed publications with 24 chapters. He has been awarded with many awards, and he is very active in this field of research and surgery. Welcome, Dr. Chabra, over to you.
Thanks, Gayatri. Thanks for that kind introduction. Welcome to all participants and faculty for this JCOT webinar on scientific writing of an original article. The webinar is being held in two parts. The first one on last Sunday was a huge success. Thanks to all the participants and to the faculty in this regard. Today we have the second part of the webinar, and we look forward to have a very exciting session. May I have the next slide, please, Gayatri? I am privileged to welcome Professor Anil Arora, who is the president of Delhi Orthopedics Association. As you all know, the Journal of Clinical Orthopedics and Trauma is the official journal of Delhi Orthopedics Association. Professor Anil Arora is Senior Director, Department of Orthopedics at Max Super Specialty Hospital, and he has contributed a lot to the scientific world, is known across the globe for his work in the field of knee and hip replacement surgeries, and has been a professor at University College of Medical Sciences and GTB Hospital for 14 long years. He has been committed to research, teaching, and training, and that's why it is a special privilege to have him here. His areas of interest are robotic joint replacement, pinless computer navigation system, and body exhaust system. So may I request Professor Anil Arora to say a few words to inaugurate this webinar.
Thanks, Dr. Chabra, for these kind words. So Dr. Chabra, editorial team of JCOT, invited keynote speaker, Professor Michael Fehlings, learned faculty of this webinar, the participants of this webinar, EC of Delhi Orthopedics Association, friends, ladies and gentlemen. JCOT is Jewel of Delhi Orthopedic Association, and president as president of DOA, I have this proud privilege to welcome you on this such an informative webinar on scientific writing of an original article. Let me tell you, JCOT started long back as DJO, Delhi Journal of Orthopedics, in 2007 or so. And this was later on renamed as JCOT by Dr. Lalit Mani. He and his team were instrumental in getting his PubMed index in PubMed. It was further carried forward by our able friend, Dr. Raju Vaishya. And now it is under the leadership of Dr. H.S. Chabra, who is again a renowned academician, has been editor of various international journals, carries a wealth of experience. Now, these kinds of webinars are very, very important. Currently, the JCOT has impact factor of 1.87 and site factor of 2.3. Now, these kind of webinars are very, very important because I keep on getting fellows. The first question I ask them, do you have any experience of publication? And more than 90% times the answer is no, because of lack of experience in writing, scientific writing of an original article. It is very, very important for our country because there is a lot of clinical material which goes unpublished. So I would thank Dr. Chhabra and his editorial team to bring forward these kind of important webinars. And I see a lot of faculty. I see name of Professor A.K. Jain, who is considered one of the finest authors across the globe. He's a top 5 authors of orthopedic authors on the globe. So I wish all the best to this webinar. And once again, thank organizers of this webinar for bringing out this very, very important topic. And I think these kind of webinars will continue in future also. I wish all the success. Thank you very much.
Thank you, Professor Anil Arora, the President of Delhi Orthopedic Association, and a special thanks to also you and the entire executive and members of Delhi Orthopedic Association for the opportunity to have this journal and to disseminate information about orthopedics and trauma management through this very important journal. So thank you, and we'll look forward to continued support in this regard. Friends, I would want to also mention that this webinar is brought to you by the training committee of JCOT, and we have various members of the committee who are participating in the webinar but have toiled to bring this webinar to fruition. So we will talk more about that subsequently, but I also have the honor of introducing my distinguished colleague, Professor Michael Fehlings, Professor of Neurosurgery and at the University of Toronto. Professor Michael Fehlings, in fact, needs no introduction. He's a colleague at the International Spinal Cord Society, but is known worldwide for his prolific work in the field of research in spine. And he's one of the most prolific authors. He's director of Neuroscience program at the University of Toronto, vice chairman, Department of Surgery, co-director, spine program, Harvard Chair in Neural Repair and Regeneration, Fellow Royal Society of Canada, Fellow of the Canadian Academy of Health Sciences, and his focus area is preclinical and clinical translational research related to enhancing repair and regeneration of the injured central nervous system. Friends, Professor Michael Fehlings is also the guest editor for a JCOT virtual special issue on spine, which you will be seeing soon. So he's in fact one of us having participating in the activities of the journal, and we look forward to his address today, his keynote address today on publication ethics. So can we have Professor Michael Fehlings talk, please?
Sure, sir. I'll stop sharing here, and Ravinder, you can play the video.
Professor Michael Fehlings is available for question and answers. He is on emergency call today, but still has joined us for this webinar.
I'm Michael Fehlings, Professor of Neurosurgery at the University of Toronto and Vice Chair of Research in the Department of Surgery at the University of Toronto as well. I'm pleased to participate in this webinar put on by the JCOT journal, and I've been tasked with the challenge of discussing ethics in publication with a particular focus on plagiarism and intellectual property rights, and it's certainly quite a challenging topic. I have no relevant disclosures, but I have founded a regenerative medicine biotechnology startup called Intelligex. There's no relationship between that relationship and the current lecture. I wish to acknowledge Professor Harvinder Chhabra, who's the editor-in-chief of the Journal of Clinical Orthopedics and Trauma. I also wish to acknowledge two members of my team, Drs. Mogadamju and Kudusi, who are graduate students in my program and helped me put this lecture together. So what is intellectual property? Intellectual property, or IP, refers to creations of the mind, such as inventions, literary and artistic works, designs and symbols, names and images used in commerce. And there are various types of intellectual property that are summarized here. So there are patents, there's copyright, trademark, there's also industrial design, geographical indications, and trade secrets. And I'm going to focus on the first three. So a patent is an exclusive right granted for an invention. Generally speaking, a patent provides the patent owner with the right to decide how or whether the invention can be used by others. In exchange for this right, the patent owner makes technical information about the invention publicly available in the published patent document. Now, this has some relevance in the publishing arena, because if you are making a disclosure on unique intellectual property that you may wish to patent, it's very important to at least submit the patent before that work is going into a publication, because once this is disclosed in public, this now becomes common knowledge. A trademark is a sign capable of distinguishing the goods or services of one enterprise from those of other enterprises, and trademarks date back to ancient times when artisans used to put their signature or mark on their products. And copyright is a legal term used to describe the rights that creators have over their literary and artistic works. Works covered by copyright range from books, music, paintings, sculpture and films, to computer programs, databases, advertisements, maps, and technical drawings. And copyright is of the greatest relevance when it comes to publishing in journals. And most journals will assume the copyright of materials that you ultimately publish, but there is flexibility for negotiation. And in addition, most journals, if one publishes in an open access format, allow the authors to retain copyright. So it's important for you to understand this concept. So copyright is a legal term, and in particular, it relates to the creative efforts of individuals who have created literary and artistic works. And so it's important to recognize the intellectual property, for example, when you're citing articles that individuals have created, or alternatively, if you're using photographs or artwork that are the creation of other individuals. So how are copyrights registered and protected? So according to the 1886 Berne Convention, copyright protection is automatically granted in most countries without the requirement for registration or other procedures. And so what this means is that if an individual has created an essay or a piece of artwork, by and large, they automatically will own copyright on that material. Now, several countries, in addition to this, have a system in place that permits the voluntary registration of works for copyrights. And such systems of voluntary registration can aid in the resolution of ownership or creation disputes, as well as in the facilitation of business dealings, sales, and the assignment and or transfer of rights. And this is of direct relevance to journals such as JCOT, which generally will assume the copyright of articles or materials published in that journal. So when authors publish their work in a journal, they do not automatically hand over the copyright of the written work and any other audiovisual part of the publication, such as images, videos, etc., to the publication. There is an opportunity to potentially negotiate materials that you might want to retain copyright over. And I have done this on occasion for certain forms of artwork. And importantly, open access agreements usually allow the retention of copyright, so you should examine this. Most journals do have clauses that transfer copyrights of the works to them, and oftentimes the authors are not aware of this. So you want to read this carefully to understand what you're signing. In such a scenario, the author or authors will need to seek the permission from the journal for the images that they previously published in the journal for another article or presentation. So you need to be aware of this. And importantly, authors should be aware that they do not need necessarily to hand over copyrights of all the materials to a journal, and that they may be able to negotiate the terms of the publication. It really depends on a particular journal. And again, of interest, most journals with open access agreements will allow the retention by the authors of copyright. So that's a potential advantage of going open access. Now, plagiarism. Okay, so plagiarism is presenting work or ideas from another source as your own, with or without consent of the original author, by incorporating it into your work without full acknowledgement. This is a serious form of academic dishonesty. In most countries, it is not strictly speaking a criminal offense, but in some countries, it can be prosecuted as a criminal offense under certain laws, as are copyright laws, which often deal with plagiarism. So it's important for you to be aware of this. So what types of plagiarism are there? Well, there's intentional plagiarism, there's unintentional plagiarism, and then there's self-plagiarism. And so self-plagiarism, if you're well published in the field, may arise inadvertently, and journals may flag this and ask you to reword the materials. And then there's unintentional plagiarism, where you perhaps may not be aware of some of the issues that I will describe. So different forms of plagiarism. So there's a verbatim form, which is a word-for-word quotation without a clear acknowledgement. So this is probably one of the worst forms of plagiarism. Then there's cutting and pasting from the internet without clear acknowledgement, and that's a serious transgression. Paraphrasing, depending on how you do this. So you need to be careful, because you need to really be diligent in terms of how you reword the phrasing. And then there's collusion, inaccurate citation, failure to acknowledge assistance of others. And then there's the use of material written by professional agencies or other persons. So beware of ghostwriters, because this is also considered to be an unethical form of creating an article. And then there's auto-plagiarism, which can occur if you're well published. So the consequences of plagiarism will vary. If it's unintentional and it's fairly minor, there's really very few consequences, apart from the fact that the journal may ask you to reword some of the passages. But more serious forms of plagiarism can have serious consequences. So there can be a rejection of the publication, and possibly a ban from that journal and many other journals, because the journals do communicate with each other, and there are associations, for example, the Thomson Reuters, which creates the H-index that allows journals to communicate with each other. There can also be academic consequences, which can have a fairly serious impact on your career. Of course, there's bad publicity and so on. So how do you prevent plagiarism? So whether or not you're paraphrasing, you should always cite the article, the webpage, or the other source when writing. So you need to be meticulous in terms of providing recognition of the authorship of materials that you're citing. Now, if the exact words have to be used from a source, and I would discourage you from doing that, but if there's a particular phrase that you wish to cite, you should indent that phrase, and you should clearly isolate this from your own text with quotation marks, and this should be done in addition to citing the source. You can use software packages such as Turnitin, and there are other software packages that are available to check for plagiarism before submitting any piece of writing for publication. And trust me, the journals are increasingly using these software packages as well. It's important to be mindful to not just cite the sources, but to cite them accurately. So here I'll give you an example from my own work of how to cite something properly. And again, when citing a source verbatim, word for word, it's mandatory to set this aside, so indent this, and then place this into quotation marks. If quotation marks are not used, and if you're citing something word for word, even if you reference this, this is considered plagiarism. So here's an example. So here's something from my own work. The task is a study on the timing of surgery for acute spinal cord injury. And let's imagine that you've decided that you want to take this paragraph verbatim and you cite the source, but this actually would be considered plagiarism. What would be not considered plagiarism if you do exactly the same thing, but you indent this paragraph and then you place it into quotation marks with a clear citation of the reference. But again, I would dissuade you from quoting material verbatim too much. Really only do this quite selectively when absolutely necessary. So the journals are really attuned to the concept of plagiarism, which is partly why I'm giving you this seminar. And the journals and authors as well can use software such as Turnitin when reviewing submissions. The journals will usually take immediate action when plagiarism is suspected, will contact the authors, and they may contact the host institution, and if it's in the case of a trainee, the supervisors. So it's very important to be really aware of what constitutes a plagiarism. And again, I would encourage authors to be very vigilant in their academic rigor in terms of doing this. And this is really a part of a good practice and a standardized methodology. Now, there are challenges in dealing with plagiarism because there are obviously gray areas. And I will talk about this a little bit in the context of artificial intelligence. A common definition of plagiarism does not exist between institutions and regions, and a lack of due process in case an accusation of plagiarism is made can occur. And sometimes there's just simply lack of awareness, which is, again, part of the reason for giving this lecture. So if English is not your first language, if you're coming from a different culture, you may not be aware of some of the issues that I've discussed. And then the use of artificial intelligence programs such as ChatGPT presents unique challenges. And this is an evolving landscape. The use of such software should be acknowledged, but authors cannot be granted to an AI platform. And you ultimately are responsible for what's created, including the potential that that AI platform has plagiarized materials from the literature. So let me give you an example here and to show you what generative artificial intelligence is. And we've created this video.
Generative AI is a branch of artificial intelligence that focuses on creating new content, such as images, videos, music, or text, by learning from existing data. It uses deep learning algorithms to analyze and understand patterns and structures in data and generate new content that is similar in style or content to the original input. Generative.
So that a video was developed entirely through artificial intelligence. So the person, voice, text, and video were all generated by asking the software to create a short video on what is generative AI. So it's really quite remarkable. And so it becomes tricky. So this was my idea to create this. We gave instructions to ChatGPT, and it's created this video. So in a sense, it is my creative input, but we need to be also very careful, particularly when we're creating written material, that the software package is not plagiarizing. So what is ChatGPT? So let's ask it. I'm an AI language model called ChatGPT, developed by OpenAI. My purpose is to assist and communicate with users by generating human-like responses to their questions or prompts. I do not have a physical form or consciousness, but I am constantly learning and evolving through training on vast amounts of text data. So this is actually, if you put this question to ChatGPT. So let me give you some further examples. And so this is, again, from my own work. And so one of these abstracts was written by me as part of the Staskis paper. The other abstract was created by asking ChatGPT to create an abstract based on the 2012 Staskis article authored by Fehlings et al. So abstract on the left, I'll just read the first sentence. The preclinical evidence supports that early decompression can enhance neurological outcomes in spinal cord injury cases. The second abstract. There is convincing preclinical evidence that early decompression in the setting of spinal cord injury improves neurologic outcomes. So the one on the left, you may have guessed this, it was 100% generated by ChatGPT. And the one on the right is the original abstract, but the ChatGPT abstract is pretty darn good. Very interesting. Abstracts written by ChatGPT can fool scientists. And if you could not detect a difference, you're not alone. A recent article compared 50 AI-generated abstracts with handwritten ones. 100% passed the originality score from popular or plagiarism software, and 68% of the AI-generated abstracts were identified as AI by an expert scientist, and 86% of the genuine abstracts were correctly identified by the same cohort. How smart is ChatGPT? Well, it's not just good at language processing. The ChatGPT software package was able to pass the USMLE examination on its own. And here's an article in PLOS Digital Health on performance of the ChatGPT on the USMLEs. So quite remarkable. Here's artwork that was completely generated by AI. This won an art competition around the world, and this actually set a fierce backlash in motion from our artists around the world. You can just imagine. Now, is AI plagiarism? So this is tricky. So let's go back to plagiarism. Plagiarism is the act of using someone else's work or ideas without giving proper credit to the original author. But the work is generated by something and not someone, so the definition is unclear. And then in addition, you're interfacing with this software package. Most popular AI generative technologies indicate in their terms of service that the generative work is a property of the user who put the input and not the company. This is explicitly stated in the terms of service of ChatGPT. But again, be very careful in using the software package, and it's very critical that you run a plagiarism test on this. Should AI work generated be cited? And in fact, there are 4 articles in PubMed that have listed ChatGPT as a co-author, and here's a couple of them that are cited. Most journals, however, discourage this practice, as a software program cannot really be considered an author, and you're responsible ultimately for the work that is created. Can you detect if text is AI generated? So while not perfect, there are now several emerging tools that claim to detect if a text is AI generated, and these are listed here, including originality.ai. So where is AI in scientific publishing going? AI generative work is an emerging phenomenon, and issues of plagiarism and IP are yet to be defined with the use of these software packages. So take-home messages from my lecture. 1, be aware of copyright issues. You can retain copyright on your original images if you negotiate with the journals, and open access agreements usually allow you to retain copyright. 2, be aware of plagiarism. Use your own words whenever possible. Cite the sources accurately. Use italics if directly quoting, and use software packages such as Turnitin to double check for the potential for plagiarism, even if it's unintentional. And 3, be aware of the emerging landscape of AI, including ChatGPT. I would say be cautious in the use of these technologies, but you should also be aware of this as well. On that note, I'd like to close out the lecture, and I'm pleased to take questions and to participate in discussion.
Thank you, Professor Michael Fehlings. That was a very interesting talk, and we now throw the topic open for discussion. If there are any queries, please raise your hand or write down on the chat box. I believe those who are participating through OrthoTV could also send their questions through Zoom. We have Dr. Vineet Arora, who has raised his hand. Dr. Vineet Arora, please go ahead. Please unmute yourself, Vineet. Dr. Vineet.
Yeah, sorry. Good evening, everyone. Thanks, Professor Fehlings, for your marvelous presentation and making very clear ideas about all the to the various authors. My question is very simple. In the previous lecture, last part, which we have understood, while we are writing introduction, so we were able to write certain kind of paraphrases. So will that be considered as a plagiarism? That is one. And secondly, can the use of chat GPT is also considered as type of this paraphrasing plagiarism?
So thank you. So this issue raises questions around plagiarism, and there are areas that are black and white, and then there's areas that are gray. So in general, a lot of us do paraphrase the literature. We read the literature and then we paraphrase this in our own words. And I think in general, this is a very acceptable scholarly action. Sometimes the software packages, particularly if you're summarizing your own work, will detect similarities and cite this as plagiarism. And so you may sometimes be requested by journals to rephrase certain actions. But in general, paraphrasing, and then if you cite the sources, is quite acceptable. And I think any overlaps that are observed by a journal would not be viewed as a transgression and would be viewed as a very minor issue. And this occurs from time to time. And this is probably the most common thing that I see cited. Okay, so that's, I think, a minor issue. Now, the issue of chat GPT is tricky. And I mention this because it's become very popular. And I'm not endorsing the use of chat GPT, but it clearly exists. And regardless of what I think or don't think, people will likely use it. But I would be very cautious in terms of the use. So this is a software package that will access the internet broadly. And you need to be very careful that, for example, it hasn't, say, paraphrased or even plagiarized someone else's intellectual work. And so you need to be rigorous in terms of running the software on this. And there are, I recognize that, depending on one's language background and cultural background, that writing in English can be technically challenging. And there are, language software packages that will take your original text and will clean this as well. And I think that is probably a safer technique to use. If you do use ChatGPT, then you need to cite that this has been done. And I think the journals right now are struggling with how to handle this. Okay, so I'm not aware of a policy, but for example, the Nature publications will not accept ChatGPT as an author. So you can't cite this as an author.
Perfect. Thank you very much, sir. Thanks for the map.
Thanks, Professor Michael Fehlings. Incidentally, today we were discussing about chat GPT, and we also came to know that, like Authenticate, there's another software being developed which can help you detect if it has been generated through chat GPT or not. So it's something which will gradually evolve. Similarity also has been a topic of interest in the last 2 decades only, or in the last decade more so. You mentioned that there's no common definition which exists for similarity. Now, in that context, and with so much attention being given to similarity or plagiarism by all the journals, now, how does a common author, means a young scientist, how does he determine where to move forward? We tried to net search, and we found out, of course, there's the Committee on Publication Ethics, or COPE, which defines it. Then there's a Council of Scientific Editors. Then there is an International Committee of Medical Journal Editors, and there is a World Association of Medical Editors. So these generally are the four which have been giving out guidelines in this regard. But there was no, as you had mentioned, there was no standardization, right? COPE mentions less than 10% similarity. But in our journal, we have struggled to see people reach that level of similarity. So why haven't all of them also given attention to this to define similarity clearly? Another thing that I've seen is, for example, there are filters within Authenticate, right? Now, I came to know because the reports which were being generated by the journal office, and some authors challenged that. They said our reports are different with Authenticate. And when I found out they had used the 9-word minimum filter, and the journal office said, no, we do not use this filter. So the author said, let us know the guidelines which dictate that this filter should not be used. It's present in Authenticate, and most of the journals say Authenticate is the software to use. Also, many guidelines mention that. So how should we standardize? How does a common person know what should be the similarity within the paper that he publishes?
Professor Chabra, Harvinder, thank you for the very thoughtful question. And you've clearly put a great deal of thought into this, and you're very aware of the different standards. And I alluded to this briefly, that there is not an absolute standardization across the field. And to be honest with you, I still think that this is why we need human beings to provide judgment, on this. And I'll just cite a personal example. I was recently invited to provide an article. It was a narrative and scoping review on the topic of spinal cord injury. And they ran a plagiarism software, and they said, oh, there was 40% overlap. So I said, can I please see the report? And some of the phrases that they said was overlap was, one phrase was management of spinal cord injury. Well, okay. And I said to the journal, I said, well, you can't possibly consider this to be a plagiarized phrase. This is just such a common phrase, and this has been my life's work. So they acknowledged this. And so there was a bit of back and forth. And then there were 3 phrases in my own article, which I looked at. They were all paraphrased, but I said, okay, you know what? I'll just reword these a little bit. And we kind of went back and forth. So I think there's kind of the back and forth. And I think that most scholars are honest, and there's a lot of gray, and a lot of the gray arises in paraphrasing. So to what extent do you paraphrase and then it becomes your own work versus someone else's work? And there's only so many words in the English language that can be used to describe phenomena. So I think here judgment is required. And I would say that the filters are not perfect. They're a first pass screen. They will certainly detect if, in the very, very rare circumstance that an author has actually done significant intentional plagiarism, that's what we want to guard against, absolutely. And then I think a lot of the other things become gray and are minor. And then I think here it's a discussion still between the senior editors and the authors. And I think the reason that there are not firmly established guidelines is that it's recognized that there's gray and that there's a lot of judgment that is required. And then in terms of ChatGPT, this is a disruptive technology. Like, it's remarkable. I showed the video that my students actually helped me create this. This is why I acknowledged my 2 students there. And this entire video, including the person, was created. And so I acknowledged that it was created by ChatGPT with our intellectual input. But would I be prepared to say, create a video like this and say, send it to JCOT and say, oh, this is my technical video on how to do this procedure or whatever, I would be pretty worried about doing that. I wouldn't feel like this was really kind of genuine, but the work's evolving, and I think that for scientists, for academic physicians and journals, this is going to represent a substantial challenge. So I would say that this is something that people like you and I will really be debating and struggling with. But at the end of the day, the software packages are tools, and they're not a replacement for judgment.
Thanks, Professor Michael Fehlings. I think the message that we get also from what we have just discussed is that the editors should not just rely on the journal office's interpretation or the software's interpretation of what is the similarity or plagiarism in that. And also for somebody who is publishing, if you get a message from the journal office that similarity is too high, but if you believe that it may not be as high and they haven't done justice, you should write back to the editors and you should discuss with them in this regard. One quick question again, I think we in publication ethics also comes the issue of the editorial board publishing in the same journal, and the number of publications that the members of the editorial board could publish in the same journal, because I think there were some guidelines which would try to ensure that people do not use their position to get their publications published in the same journal. So we also did some research in this regard, and generally the guidelines of the 4 different sources that I mentioned that the number of publications of the editors should be less than 20% and of the total publications. What are your views in this regard? Should this hinder publication of genuine articles, genuine public research work done by the editorial board members, because they are all researchers in that regard also? So what are your views in this regard?
I think, again, there are no black and white answers here. It is, it's gray. I would say that, frequently editorial board members are asked to provide an invited editorial or an invited article, and that can be handled by the journal as indicating that this was an invited article. And I think there's, that is correct, because I think that is fine. And then I think the people that are on the editorial board, I think, in general, I think it's a good thing for people to selectively publish in the journal because it shows their endorsement of the journal. But you need to also participate in the same peer review process as anyone else. So your work needs to meet the standards. So just because you're on the editorial board, it cannot give you preferred access in the peer-reviewed arena. And so I think it's a bit of it's a bit of a balance. So I think that journals such as JCOT do a very good job of this. I think there are focus issues such as the one that we are putting out right now on spinal cord injury and spine trauma. It's clearly identified as a focus issue. But again, all of the articles undergo peer review. Now, it is recognized that it's a focus issue and these are invited articles, but I think that's also made clear. And I think people kind of have that, that understanding that this is, that these are articles that have been requested. So I would say that, it's a balance. I think it is important for people on the editorial board to support the journal, but I think we actually do a pretty good job, to be honest with you. I think in terms of the reputable peer-reviewed journals, A word of caution, though, to the younger, emerging scientists and academic physicians in the audience, and this relates to predatory journals. And so just be very, very careful when you get an email in your inbox inviting you to submit an article to a journal, and then you'll quickly see that there are very large open access fees. And then they will promise you very rapid turnaround and very rapid quote unquote peer review. And if you get such an email, be very, very careful, because in general, the top journals won't do this. If you see this, go online and check if it's a registered journal. Are they listed on PubMed? Are they, do they have an H index? All of these sorts of things, just to check. So I would say that becomes very difficult. And this really, these predatory journals are a huge disservice to all of us, because the work that gets published there, if it gets published, is often not of the best quality. So I think that is one of the big threats that I see as well to scientific integrity in the area of publishing.
Thank you, Professor Michael Fehlings, for a very interesting talk and an equally interesting discussion. I think we can go on and on in this discussion. It can make a whole conference. There are various issues. I think what you have tried to mention is that as responsible individuals, all stakeholders need to play a role to ensure that science is ethically documented and published. So whether it's the author, whether it's the editor, whether it's the journal, or whether they are the associations which come out with guidelines, we need to play a role so that we can allow ethical work to be published, and on the other hand, we can filter out unethical work in this regard. So that's a very good message, and we'd want to thank you, Professor Michael Fehlings, for taking out time on this early Sunday morning, and that too on the day of your emergency. For all of us, we do hope that you will participate in subsequent sessions as well, and we look forward to a continued collaboration. Thank you very much, and have a great Sunday. Over to you,
Thank you very
Gayatri.
much.
Thank you.
President
Over to you,
Chhabra.
Gayatri.
Take care. Bye-bye. Bye-bye.
Thank you, sir. Thank you. Thank you, Dr. Fehling, for the wonderful session. Even I was thinking about AI, that it's an era of AI. I was remembering my old days when I used to write the letters for my family, friends, and this is the era where we can directly call and chat with them. There is no need to write and post the letters. And the coming years will be AI, but I was not thinking about that. It will be so early to have this chat GPT in the research, but this can be done, and let's see how it is moving. So this was the day one, what we have discussed. We were having 3 modules of regarding to manuscript central. We have reading titles, research question and hypothesis, then writing abstract. Now we have day 2 activity. We are starting with the session 1, which is writing the method section in citation manager. So we have among us Dr. Vandana Farke. She is going to moderate this session. Dr. Vandana Farke is by profession is a physiotherapist and working as a scientist D in Indian Spinal Injury Center, New Delhi. She is a postdoc from the National Center of Biological Science, TIFR, Bangalore. She is a principal and co-investigator in many government-funded projects, including DBT, Brazil, and many centers in India. She is currently associated with JCOT as an associate editor and past editor experience in Brazilian Journal of PT. Welcome, Dr. Vandana. Over to you.
Thank you so much, Dr. Gayatri. Thank you for the warm welcome. And thank you for the opportunity today to lead a panel discussion on one of the important topics about scientific writing, that is about how to write the methods section. So I think the program is slightly delayed. So without any further delay, I'm going to start and introduce my panelists. The first one with us is Dr. Anil Jain. He's a principal of UCMS and the director, professor, and the head of the Department of Orthopaedics. He's also the Dean Faculty of Medical Sciences, University of Delhi. He's a past president of IOA, and he's had a tremendous editorial experience with multiple journals, including the National Academy of Medical Sciences, ISJ, IJO, JBJS, and many more. He has published prolifically through the years. Welcome, Dr. Anil Jain. It's a privilege for us to have you with us. And next we have Dr. Sandeep Patel. He's a consultant at PGI Chandigarh, also a very prolific author, and he has published more than 120 articles, and he has 2 patents to his credentials. A very warm welcome to both of you, and thank you for participating in this panel discussion today with us. So today we're going to talk about 2 very disparate topics. One was about writing the methods section, but because we wanted to introduce the budding writers to citation managers as well, the topic was clubbed together. So the first section is about writing the methods section. And my first question to both the panelists over here is, what do you think are the most essential or mandatory details that need to be mentioned in the methods section? Dr. Anil Jain, sir, if you could start.
Thanks for asking this question. I think the method section is one of the most common cause of rejection of manuscript at first instance. Besides the highlighting the explicit research question, the method section comes the next. And I can give one tip that method section should be written in a way that if the reader is reading the method section, can do the same study. It should be so clear, which includes every aspect that for your topic. What are the inclusion criteria? What are the exclusion criteria? How you have chosen your subjects for clinical work or for experimental work? And before that, how you have decided the sample size and what is the basis to decide the sample size? Because on that basis, if you have decided what is the inclusion and what are the exclusion and what is the number, then only we can move on. And how that study should be done, whether it is experimental. So what are the requirements for those experimental and what are the sources from where you can get those things? Or even for clinical, what are going to be your steps to conduct that study, whether it is a operative study or a non-operative study, whatever way, what you are going to how you are going to intervene and how you are going to observe the changes or the outcome. And the most important is what is the end point where you are going to evaluate your outcome, and what is the instrument of by which you are going to evaluate the outcome, how you are going to retrieve that information, put up in a sheet, what are the software you are going to use, and what statistical information test you are going to do to discern whether the outcome difference is valid or not valid. So if these are written in a way, in a sequential manner, then and anyone reading it, if reader is confident to conduct that study, then this is a very good method section. I mean, I would take it this way.
Thank you, sir. Yes, you talked about having it very detailed and enough details for anybody to replicate. Yes, sir. Dr. Sandeep Patel, would you like to add anything to it, sir?
Yeah, so it's rightly pointed out by sir as well. See, the thing is, if I want to summarize, it's like a recipe, step 1, 2, 3. So you should be passionate about it and make it very clear. So if you go back 10 years before, it was a bit difficult, but now it's actually very easy. So the easiest way to do it is that because we have the equator network and the various reporting guidelines. So things are much easier these days because you just have to go through it first, understand what the study is, whether it's a randomized control trial, whether it's an observational study. If it's a randomized control trial, we have the consort guidelines and the checklist. We have a stroke guideline for observational studies. If it's an animal study, we have the arrive guidelines. So things are very easy. You just have to go download the checklist. And then if you go through it in the checklist, we have a lot of things. For instance, let's talk about a randomized control trial. So in the methodology, the first thing is it's there in the checklist, even it, the level of acceptance of your article will be very good if you submit the checklist along with it. In the checklist, it's clearly written in the methodology. First is the trial design. So you have to write about the trial design. Then the participants, how did you enroll the participants? What was the intervention arm? And then how did you look at the outcomes? How the sample size was calculated? So, I mean, things are pretty easy. The only thing is that you have to stick to this. Now, the problem, the next second tip is you should know that these things exist before you design a study. There are certain things which you cannot do once a study is done. So this is a message for all those listening there, especially who have not done much of a studies or yet still into designing trials. It so happens that when we have our students who come in to take, so if we as mentors don't guide them into the good methodology, it's not done. So it is actually designing the study before they start the study. So the methodology is exactly where before they're writing the protocol, it should be it will be done like this, it will be done like this, just follow them. And once the study is done, you just have to convert it into past tense. This was done. This. So that's it. So the takeaway message is there are guidelines for all type of study. Identify which study it is, follow the relevant guidelines. Second tip is, again, now it's a challenge to get your article published in good journals if you don't have the CTRI registration for a clinical trial. So again, this cannot be done retrospective. Your first patient is enrolled, the CTRI will not register your study. So the clinical trial registry India has to, it's advisable that you register your trial. Otherwise, all the top journals are out of question. Yeah.
Thank you, sir. Yes. In fact, I had that in my next slide because I thought we should not forget mentioning these details. That after you talk about the design of the study, a mandatory thing is talking about ethical clearances for the study and the CTRI registration, as you suggested. Yes, those are mandatory details now. Now let's go over to the important subsections of the methods part, because we have to cover a lot of ground there. As you suggested, there's a lot of details that need to go. I would really appreciate if both of you would talk in terms of what should get included in this subsection and what should be the writing style to write it. So if you could just comment on both parts of it. So Dr. Jain, I would first throw in the subsection of sample details or subjects as to what should be there when writing this part.
I think before coming to this, I would love to reiterate that correctly writing is something which you can improve upon, but not doing in a correct manner and then writing becomes a problem. And that is why what Sandeep has said is absolutely fine, that this rigorous work has to be done before starting the study. Your all things, what you want to, in a manner you do, it should be done in a methodical manner. Then only that you can write about it. You cannot generate some information once you have already done it. So that's all true. Information. Now, here we are talking about how to write in about 500 to 700 words, concising the whole information of your whole study in the method section. This is what the point of discussion here. But doing the study as per design in a correct manner is the key, which includes ethical clearance, which include informed consent, which include if any registration is required for the study, that includes all. I think as far as the sample detail is concerned, I think this should start with how you have decided the sample size. And I think you need a few word lines, a paragraph in consultation with your statistician, that how have you come across to that sample size. And because what we are looking for a statistically valid difference in the outcome. And that can only be possible if you have a proper sample size. Now, this problem comes when you have a thesis vis-a-vis the research. So, because in thesis, it's a fixed time, 1.5 year study, which you will enroll your data for 6 months, 9 months, and then subsequently evaluate. So I think you have to choose a subject also properly so that you are able to do a study with a properly defined sample size. Now, it should include your inclusion, it should include your exclusion, and it should include what relevant investigations or what relevant things were done with that those patients before or sample before being part of the study.
Right. Thank you, sir. Dr. Patel, would you like to add to it?
Yeah, actually, sample size, this is the most difficult part of any study. The reason being, a lot of things are not in our control. And if you actually go, if you want to get down any study in literature randomly, 90% of the study, you can pin them down by saying your sample size is not correct, and which is actually true, because there's a lot of challenges in designing it. It also depends on what kind of study it is. So journals to an extent are flexible, but still we have to write it right. So the sample size is more important if you are planning a randomized controlled trial, a comparative study. So standard is, and it all depends on what is the primary outcome measure. For example, it's the pain VAS, or it's the primary if you're using a Q score or a WOMAC score, whatever. So there's a standard for every scoring parameter. Your statistician will know. So initially the statistician will ask the incidence of the disease, how frequently you're getting, and the power, how much you got to power. So these words, they look into it, the power of the study and the assumed false positive rate, and which is the primary outcome measure. We set the sample size as such. These are those keywords which has there to be there. But we all know, having done research on this end, it's not there are certain diseases where the sample size runs in hundreds, so we cannot actually go and achieve that. So that's why I started with, it's the most challenging thing, but these keywords needs to be there. And another thing is, most of the type of studies are observatory retrospective studies. There literally doesn't matter. There you just have to say, from the time duration of this much and this much, we went through the cases, and these many cases met the inclusion exclusion criteria and they were included. Anyways, when it's a retrospective study, the value of study goes down. So even the authors, the reviewers are more stringent when you state it is a randomized controlled trial. So when you're doing that, then all the precautions needs to be done in setting the sample size right.
Right. Thank you, sir. I also had some points that I got from literature about what should be included in the sample size. And as you pointed out very correctly, please include a statistician when it comes to writing the statistical part of it to make it more valid. And certain extra points which I thought were important to be included apart from the number and the inclusion exclusion criteria is also the location of the study. So if you're doing a study in a rural India versus a corporate hospital in Delhi, the kind of patients are going to be different. So describe, where are you getting your patients from? How are you randomizing them into group? What is the allocation method? So I think all of those details need to go when you describe your sample. It's all about being able to replicate it. Next comes what the materials we use. And we have a very diverse audience today. Many of them would be orthopedic surgeons. So they would be maybe surgical procedure equipment, they could be radiologists, or they could be basic scientists, and materials could be they could be very diverse. So what all details need to go in describing these materials? Let's start with you, Dr. Patel, this time.
Yeah, so let's go this way. So let's take one by one example. Suppose it's the radiology audience. So we are doing a radiographic study. It's the studying with the CT scans. So you have to specifically clear what what sequence you acquired, in what thickness you acquired. For suppose we are studying a syndesmosis. So exactly we need a 1 mm cuts, finer cuts. So we need to mention that at what level above, yes, and then which software, Horos, if it's a Mac, or any compatible Horos device, in what it is done. So this is the software. On the contrary, let's talk about robotic surgery being done. We have to specifically mention which is the type of the robot and what is the settings which you have used, standardized throughout the study. Let's talk about another thing. We are doing a PRP preparation. So which is the biocabinet, all those stuff. And if you're doing an experimental study, the reagents name, where they come, so where you procured from, exact details should be there, which company, like Terumo company, Bio, all those details. So that is actually important, because when you review it, when we know that the details have been provided, we know that the submitting author knows about the matter and they have written it. So it gives a good thing. So we have to be very crystal clear.
Right, sir. Would you wish to add anything, Dr. Jain?
Yes, see, like as far as the sample detail is concerned, I think that will vary with the type of study. It's very important. I know we all know that retrospective studies, they are little down than the prospective study. But if a retrospective, I mean, I'm almost 50% study published are retrospective. So we just cannot say that we will not allow a retrospective study to be conducted. Yes, they generally give some valid information, provided we include all consecutive cases from where we are getting the retrospective data. So it has to be certain number of consecutive cases in that duration being enrolled in your hospital or in your setting. And then we are doing a retrospective out of those patients. And if the retrospective data retrieval is 80% and more, then that becomes a better study than a poorly done prospective study. So it's very important that we write very clearly, depending on the study design, that this was the sample retrieved in this duration, and this was the sample being followed. Even for prospective, if I've done 50 patients, but then I kept on excluding some. So a consecutively conducted prospective study is better than just randomly collected few prospective cases. So these all makes a very important difference as far as the validity or importance of the evidence generated is concerned. Similarly,
yes,
I
very
think
good point there. Yes, that the reason why you lost subjects to follow up is an important reason
absolutely,
which has to be mentioned. Yes,
it should not be. It should not be that I'm saying that I've done 20 good outcomes and publishing those 20 good outcomes and forgetting about 30 who have not come because they have developed complication and they have gone to some other clinician, some other institution. So that is why the validity comes down and the evidence generated becomes poor. So that is why it's important that whatever we do honestly, that yes, this was the source material, and that is why the consecutively collected data is always a superior data than the randomly collected patients. Now, as far as I think Sandeep has already covered this material part of it, that yes, whenever you do a study and you submit for certain, say for example, I'm doing a CT guided biopsy of a spinal lesion, then in that case, I'm subjecting it for smear, for culture, for genotype typic analysis, for this and all that. Then I need to give little detail that what genotypic methods I'm going to use, which the material will come from where, how it will be done. So I think, as I said in the beginning, if method section written well, that anyone reading can conduct the study, that's a very good method.
I agree. Yes, thank you. Yes. Another thing which I, as a reviewer or an editor, we look forward to is the validity and reliability of the tools that are used. So if you're using a pain score or if you're using something, you need to show that it has been a reliable tool or a valid tool. And if any calibrations were used, all of those details need to go. The next is the detail of procedure or the protocol that gets followed. Once a subject comes in, what do you do? So just can you highlight on the language, how do you write that section? I know what details had to be added, I think. Now let's just talk about how should you present that information? Anyone?
Yeah.
So Patel, would you like to start again? Yeah.
It's basically, as I said, it's like a recipe, but at the same time, I want to give a message here. There are certain times, we are not always getting new things. There are already studies published before, and we are following the same protocol. So in those instances, one tip is you can always quote for example, to validate the X-ray, we used these criteria by this et al. So you can use citations there. So this is one tip. You don't need, so if it's nothing new, there is no point of always repeating everything. If you where you use standard procedures which I have mentioned before in the studies, you can always quote them. be it an animal model which you have used, you don't need to explain about the animal model again. Suppose a surgical procedure, you want to describe a surgical procedure, which is pretty common. So you can always write the standard operating procedure for instance, spinopelvic fixation, as described by this et al. In this study was followed. But if it is something new, you have a change in the protocol, then the operative procedure has to be written. So it has to be crisp and it has to be informative also. So that is something which I wanted to point it out.
Very true, sir. Dr. Jain, you would
I think
to add?
I think he has rightly put it. The word research means plus search. Something which has already been searched, we are trying to research or trying to put a new light. So I think whatever is known, what is already known, that we can cite with the reference, and whatever new is being added with the reasoning why new is being added, and whether what you are doing is a valid after ethical clearance, then you just write what difference of the procedure or what difference of the observation you have done it. I think as far as the valid instrument is concerned, I think it should be valid. You just can't create your own instrument to assess the result. You have to take a valid instrument which is already accepted, number one. And if at all you wish to do it, then there are methods, there are steps by which you can generate a new instrument to do it. But for that, you need to have a observer variation and all other things to be done before being used on in a study. But you must use a valid instrument only.
Thank you so much. And I think I've just put on all the subsections that people can look into. And the last one is, of course, when we talk about how are we going to analyze that data. And we have Dr. Gayatri's entire session, which is going to look at it in the activity later on, so we can leave certain details. But please go through it, Dr. Jain, as to what all details need to go in terms of the data analysis, what all should be there when you write this subsection of methods for data analysis.
Well, as I said, the difference in the outcome or difference in the observation should be significant, and that should significant or not significant should be very well, should be statistical methods, proper statistical methods to be used to say the outcome is statistically statistically significant, which are important for our research question. And that is why probably this section should always be done with the help of statistician.
Right. So what differences are you expecting? Your dependent and your independent variables need to explicitly go there. Yes, very true, sir. Dr. Patel, would you like to add to that part, sir?
I would want to talk about data reduction. That's something very important. So what happens is, for example, we go out to do a study on knee osteoarthritis. So our questionnaire is usually very, so when we prepare the method, so there's hundreds of questions and so much data is required. So first time researcher will always be confused. This data is so huge. How am I gonna reduce it? So the first important step is data reduction. Data reduction is where we take out the important, so, when we're writing a paper, I think this was discussed in your last thing, it has to be crisp. There is a message for your paper overall. So when you have a data, so probably his research question on knee osteoarthritis will capture 100 parameters, but you would have decided what you are going to address in one particular paper. And those relevant parameters have first to be filtered out. This is one step of data reduction. And second is converting them into, so that you can get the statistics done. Now we are going slightly moving towards the result section. Sometimes we have to convert yes or no into 1 or 2, or then use two variables so that we can start grouping them and apply the particular statistical tools to get out the results. So data reduction is very important. And at the same time, data reduction, the best way of doing is, so whatever study you are going to do, there will be 3 or 4 good studies on the same topic out there in the literature. Go get those studies, see what all parameters have they seen there and found to be relevant, or they got a difference. Make sure you include those parameters in your study. So automatically from the 100, you are already narrowed down to some 5 or 10 parameters which you need. But at the same time, keep an eagle's eye for everything else as well. There may be certain parameters which you have got new in your study. So you should include them to bring out that change. So, and so that huge data we have to condense, that is data reduction, and then take it forward. So here again, with the help of a statistician, you should work in conjunction, and with the mentor who have suggested an idea. Usually the senior mentor will have something in his mind as to what he's looking forward for. Those relevant parameters needs to be taken out.
Right. Very true, sir. So in procedure, we tell that the X-ray was done, but any angle which was measured on the X-ray needs to go in those details. If they were measured by two people, if reliability was calculated, all of those details need to go there. And in the statistics, I'll just end it with saying that, yes, apart from the variables, do mention what tests are you going to do? How are you going to test the assumptions for doing those tests? What p-value are you looking at to be significant, and what software do you use to calculate those statistics? So those are few things that need to go there in writing the data analysis section of the methods part. This is something that I have struggled with my many papers because as even Dr. Fehlings was saying, there are some certain sentences which are so standard, those phrases are so standard, and methods section is, I think, the least creative part of it. 20 subjects were included with unilateral adhesive capsulitis. How many different ways can I write this sentence? So how do you avoid plagiarism when writing methods section? Dr. Jain, how would you help with that?
I think by the time when you start, you have written a protocol, you have started working on it, you have worked on your data collection properly, and whatever number of cases you have honestly corrected, data is honestly analyzed. I don't think, and when you start writing the method section, you write whatever you have done rather than looking at what others are writing. You write in your own words, then try to correct and edit them. There will not be any problem in the of plagiarism in the method section, because you are writing the way you have done it. And if you are missing something that you can, what is the biggest problem is that senior people have hardly any time to write the method section. They give it to their own junior most associate, and he copies, pastes from this journal, that journal, this article, that too, and then that comes as a write-up to you, and you just correct edits, and then it's a plagiarized one. I think if someone has done the work, I mean, honestly, let me tell you, for last 20 years, I have never got the problem of plagiarism, because I tell my students, sit down with me, I'm going to dictate one method section for you. And just keep on writing and then see what we have missed. It should not be there, because, as Michael said, that there are certain management of this. These kind of words, they cannot come in the plagiarism. So method section generally is not considered for plagiarism by even the journal editors, because they know it that it is hardly. So if the authenticates tells 30%, but then they look at it and that what is the actual plagiarize, which is significant rather than insignificant plagiarism. So I think method section, my tip is just write down whatever you have done in your own words, and then see what you have missed. And then you see if you have taken some material, then take the reference or whatever the exact words for, say, I'm using CB0, then I'll write what exactly the actual word of CB0 and then give a reference.
Right. For lack of time, sir, I'm going to jump on to the next question for you, Dr. Patel, as to just summarize as to what should be the writing style for the method section. And we talked about writing it in the past tense, yes, having it detailed. If you want to just add anything to summarize this session for us now, sir.
The summarization would be follow those equator guidelines, things are in place. So you will
use the guidelines, yes.
Right from the sample size, all those things are there. And then, as sir rightly pointed out, it is your work. So you just should start dictating. So just follow the equator guidelines, and where exactly what you did, those part you start entering, things will be in place in a past tense. That's it. So that, I think that's the best summary which we can give out there.
Yes, sir. Anything else? I just had some sentences written down earlier, but yes, Dr. Jain, anything
I think
you would like to just...
The biggest problem comes because, you know what, when you give it to the junior most person, he copies the protocol and put it in the manuscript. And those small words are not read by the senior person, and it goes to journal. So if you have your writing method section afresh, you will always use the past tense, because now you have already analyzed it and you are sending it.
In fact, I was told that we should write the method section as the first part, even before writing the introduction, because that describes the entire study. So it's the first thing that you should put on paper, when you're writing it.
Yeah.
Thank you so much for that. It was a wonderful discussion. We have another part of this panel discussion is on citation managers. I have certain slides that I have prepared for the young authors to use, to introduce them to citation managers in case they don't know about it. Many of you in the audience I know would be aware about citation managers, and there are so many of them available. There are the paid versions of RefWorks and EndNote, and there are the freely available of Zotero and Mendeley, and there are more as well. Word and paper itself does a good amount of referencing, but these are very good tools that you should start using right away whenever you start doing research. I started developing my, I can say, the collection of articles that I studied 20 years, and that has been carried out till date. It just builds up over time. These are freely available softwares which work across platforms. They can get data from all browsers, put them in a cloud, and you can access them on any other platform. I believe all of you doing research have a folder like this in your computers, which says PDF versions of articles. And when you download them from the internet, they look like this crazy alphanumeric numbers. And if you were asked to pull that article out again later, you don't remember if you downloaded it, what was the author, what was the title, and you don't remember what to do with it. Versus this is what a Mendeley screen looks like. And it's like 3 columns, and it nicely organizes your work. You can input all your PDF files into it, and then you can search through it. You can divide them into folders that you can later look into. You can also have various filters. You can filter them by authors or the titles or the year and when they were published or where they were published. You can search through this. It provides you powerful tools also to search through various articles that you have downloaded. There are various means of including your articles over here. Like I had a folder, and you could import all the folders. You could also import your directories across RefWorks, EndNote, and Mendeley. They talk to each other very well. And I think what's the best feature is that while reading articles online, like if you're reading an article on PubMed, you get these web plugins, like over here on the small left corner, you can see. And this is just a small video I'm going to show you that once you're reading an article, you can download this plugin, and this plugin will import that article. It gives you the option of downloading it into a particular folder for you. And it goes into your library for later use. If a PDF is freely available, it downloads the PDF as well. So that's really useful for you while reading on PubMed, that you can import your articles right away. And once it's imported over here, the next thing is it's available for you. You can open it inside Mendeley, and it gives you very good options of highlighting certain texts and adding notes, which are going to be there forever. So I know a lot of people like reading the hard copies, but if you are okay with reading the soft copies, this is, I think, an excellent way of maintaining notes of articles. And you can access through your phones, or you can share this material with your mentors or your juniors, and your notes and everything. You can do that as well. And the final thing, which is, I think, the most important use of these citation managers is when you're writing it, you can use this to insert that citation now when you're writing it in the document file. And I've known young authors struggling with having different styles of referencing and managing that. So I've just given an example of, let's say you have downloaded it, and once you have Mendeley, you get a word plugin, which opens up into the references tab, and you can insert the citation that you would want to cite. You can search, it opens up and searches for you. Go ahead and hit OK. You can also choose the style with which you want to cite. Like it has, I think all the major journals have their means. So it's already there. So if I want to use the Vancouver or the AMA, and you just need to choose a style, and you can change between the styles, and it works absolutely fine. And the last thing is it can insert a bibliography. I've known authors struggling with, if authors need to be in a particular format, there's a comma, there's a semicolon after the year, there are the issue has to be in bold. I mean, there are just so many differences across journals in terms of writing the bibliography. You don't need to do it by hand. A software can do it for you. So learn, it's a freely available software. So this was just an introduction to Mendeley for all the young writers out there who would want to use it. Please learn it and use it. It makes a lot of work about citation very easy. So yeah, it manages all your sources, manages PDFs. Any comment from our panelists about having your experience of using any citation managers in the past?
Yes,
Yeah, so I've been using EndNote, so we are pretty comfortable with that.
Right,
So
it's similar, yeah. Mhm.
Anything but Mendeley.
Anything, just use
I was
something,
not
yes.
using Mendeley, but pretty impressed with. So I think I'll start using Mendeley also. Look very impressive, especially
It's free. That's the benefit of it, yes.
Yeah, I think
The panel is now open to questions from the audience as well. If any audience member has any questions about writing the method section or using citation managers, please, we welcome you to ask any questions, sir. Right, sir. Anyone? Yeah.
Just a comment. This is Dr. Ashok. Yeah,
yes, sir. Dr.
Excellent discussion and presentation. But just a comment that out of all sections of a scientific article, I think the least plagiarism will be there in methods and results, because this is what makes any article unique. There might be plagiarism in discussion. There might be something in overlapping in introduction. But least if it is an honest article, I don't think any plagiarism is expected out of methods and results section. Thanks.
Thank you, sir. Yes.
Dr. Barua.
Dr. Barua has a question. Yes.
Hello. It was a very nice discussion, and to have Jain sir and other one. I want to ask one question. For any case report, is it necessary to take permission from the ethical committee or IRB? Only for case report, not for series or any article.
Yes, it is. It is necessary. And one more thing, the consent of the patient is very important in a case report. One, consent, and then institutional ethics committee. Well, it doesn't matter if you are in a private sector, because there's no ethical committee which will give for that. But if you are in an institution, all institutions have the institutional review board or a departmental review board, which is fine. But consent of the patient is utmost important for a case report.
Thank you.
Right. Anywhere where human subjects are involved, you require ethical clearances. I think that's the underlining statement. Yes. So let me wrap up this session. Thank you so much, Dr. Patel and Dr. Anil Jain, sir. Thank you so much for this very enlightening discussion that we had with you. And if anybody has any questions later, they may ask. We'll be available later as well. Let's moving on to the next panel discussion. I'll introduce the moderator, who's Dr. Gayatri Vishwakarma, and she's the biostatistician with us today. She's a postdoc from Canada. She's also has multiple publications and a book chapter. She's a visiting scientist at the UT Health Center, Tyler, USA, and she's an elected member of the International Statistical Institute, the Netherlands Committee of Women in Statistics. And she's an ethics committee of multiple institutes. She's an associate editor at JCOT and at the Frontiers in Pain Research. Over to you, Dr. Gayatri, for the next panel discussion. Thank you so much.
Thank you, Dr. Vanna. It was a very wonderful discussion on this, how to write the methodology, though some of the statistics involved in it. So we have the next section on the results.
We have lost your voice, Dr. Gayatri.
I hope you can see my screen. Voice is clear? Yeah. So it's something like it's very important part of the writing because If we see, if you people are seeing Master Chef of India, you have cooked a very good dish, but how to present it? If you are presenting it in a very well manner, people will come and taste it. So this is a part of that. Everything you have done with the robust method, everything is put in a place. But if presentation is not smart enough, you might lose publishing it in a good journal. So for this panel discussion, we have three panelists among us. Dr. Alok Sood, who is the Director Professor at Lady Hardinge Medical College, New Delhi. He is a Commonwealth Fellow, Pediatric Orthopedician and Spinal Deformity, Royal Hospital for Sick Children, Edinburgh. He has more than 25 years of teaching experience to UG and PG students, medical students. He authored textbook of orthopedics for UG student by elsewhere. He contributed many chapters in PG textbook. He is a section editor of IJO JCOT. He is expert advisor at Union Public Service Commission, an examiner of National Board of Examination besides several Indian university. Welcome, sir. We have second panelist with us, Dr. Anupam Prakash. He is a director professor at Lady Hardinge Medical College. He is MD in medicine. He is editor-in-chief in Indian Journal of Medical Specialties, associate editor of API textbook of medicine. He has more than 300 publications. He authored many textbooks. He delivered more than 195 lectures and 23 paper presentation. He guided a lot of PhD and PG thesis. He received many awards like DST Young Research Award, LHMC Oration Award. He is a president of the Delhi Diabetic Forum from 2016 to 2023. And he is a president of Indian Society of I cannot pronounce this. And then he served as a member and treasurer of Association of Physicians of India. Now we have the third panelist who don't need the introduction. Everybody knows him very well. He's a renowned person in the field of biostatistics in India. He's a Dr. R.M. Pandey, who was professor of biostatistics and Department of Biostatistics and Clinical Epidemiology Unit at AIIMS, New Delhi. Currently, he's working as with the ICMR as A.S. Pentel Distinguished Scientist Chair. He was Robert Wood Johnson Clinical Scholar at UNC Chapel Hill. He was a Fellow of Royal Statistical Society, UK. He is a Secretary of Indian Clinical Epidemiological Network. He has published more than 500 publication reputed national and international journal. Sir has coordinated for the Regional Statistical Support Group for the studies on STEPS approach in CSIRO of WHO. Welcome you all, sir. Now let's start with some of the question as we are running late. We would request all the panelists if they can sum up their answer in 2 minutes. So we have a couple of questions here. The first, very important for the reporting results, that evidence does not explain itself. The results must be presented and then explained. It's something like if it's not documented, it's not done. So what's your thought on it, Dr. Sood, if we can start from you?
Yeah, definitely. We have heard our previous speakers who have elaborated much upon the method section. So whereas methods will tell you how to collect data, the results is, what was found. It answers the question, what was found. So result section actually summarizes the findings which your study has found out, right? But, whatever methodology you have used, your results will be unique. And you will, generally authors will come across many results. As previous speaker was telling about data reduction. So out of all these results, out of all the data which has been accumulated, the authors have to select only the pertinent ones, only the relevant ones, and present with that, right? They should not try to overwhelm the audience with all the data. Now, how do we know that which data is pertinent and which data is relevant? It is by going back to your research question. Now, if your data is tied to your research question, if it is answering whatever you had asked in research question, it is relevant data and you should go ahead and present it. But whatever data is not relevant, is not tied down to the research question, becomes irrelevant, and you should not convey that data. You should try to convey only what is pertinent. So that is my take on it. Can you change the slide, please? Yeah, so there are certain general rules to write a good and crisp result section. First is that keep it simple. Please do not try to confuse the reviewers and readers. Make it simple. Making it simple will just cut across all minds, right? It will simply go to the mind of the reader. Second, first be general and then specific. This is what I meant, that don't try to overwhelm the data with so many male patients, so many female patients, such and such age, and until unless it is, it is giving you a key message. So first general and then specific. This approach will give the reader an idea that what kind of study you are going to present and what he or she is expecting in your study. After this, after you have done this general and specific, again, you must go back to the research question and see whether it is answering your research question or not. Next slide. So when we are writing this research, the result section, the two common mistakes which most of us do, especially when we are new to the writing, is that we overlap the section of methodology with results and we overlap the discussion with it. So we must know that methodology is not part of results, right? So data collection is part of methodology, but your actual findings should come in results. Similarly, do not include any discussion in it, right? So how do we know? The results section, it is basically, it tells the reader what is found in your study, whereas discussion is the interpretation of these results. So these two sections should not be overlapped. So these are the common errors. So we come to the do's and don'ts. Next slide. So see, if you are clear about it, that what is included in result section, you will not do any kind of mistake in it. So start with impartial and objective tone. Do not be vague and subjective. Write only clear sentences. Try to use minimum, comparative things, adjective things. So be as objective as possible. And as I told you, just keep in mind three things. One, try to look back into your research question. Second, do not confuse with the methodology. And third, do not confuse it with discussion. So that is in brief what I want to tell you about results section.
Thank you, Dr. Sood, for summarizing it very well about the what do's and don'ts. It's very clear and crisp. Now, the second question is when to present the tables and when to present the figure. That is very confusing for the authors, like whether we have to put our data into the figures or tables. So how we do have to do with this? So if you can talk on this.
Yeah, if you can play the first slide. Yeah, so what I want to tell you over here is that text, tables, and figures, they are complementing each other. At the same time, you must remember that you should not be repeating the information. If it is given in a table, do not repeat it in text or in a figure again, because that becomes very irritating. And the space in an article in a journal is very precious. So nobody will allow that, right? And second, if you will keep repeating your data and first in text, then in tables, then figures, your credibility will come down. So immediately, it will go to revision or it might be struck down. So whether you use text and tables, how to decide? Suppose your text is lengthy with too much of data. So you can just summarize it in a table, right? So if there are too many numericals in your data, you can summarize in a table. Similarly, you can use the interpretation in the text, but you can keep all the factual knowledge in a table. So that's how you can avoid overlap, as well as you can complement your study with tables. Similarly, we can use graphics. Now, graphics will usually tell you the proportions and trends. Next slide. So figures will show you the trends and they will break the monotony. There are certain visual concepts. If they are present as part of the article, they increase the quality of the article. And sometimes the readers, they are, less oriented with numerical things. They have less inclination towards mathematics. For them, inclusion of the figures is important. Besides this, figures will be important when you are trying to present a new surgical approach, a new surgical technique. So in those kind of settings, the figures will become important. But mind you, again, whether you use tables or figures or text, they should complement each other and they should not overlap each other. I think that's what I want to say here.
Okay.
That's it. Yeah.
Okay. So this is like how to present in the body and footnotes about
Yeah,
this.
we are short of time, so I think we can avoid
Okay.
it. Yeah.
So our next question is on the what and when and what to use, specifically presenting the standard error of mean versus standard deviation. So this question, because it is more related to the statistics, I'll request Dr. Pandey sir to say on this.
Okay. Thank you very much, Dr. Gayatri, and for having me here. There are two things here. One is the standard error, and second is standard deviation. Now, there are two realities. One reality is that with great difficulty, one does one study, and based on that, generalizes finding to the target population. That is one reality. Second reality is whenever we do study, we collect a lot of data, whether in question, whether on paper, on tab, or wherever. But when we submit our manuscript, we cannot, we don't have luxury to attach our entire raw data with manuscript or thesis or whatever. So that is second reality. Now these two things address these two realities. Now, standard error of mean. See, mean is one calculation. It could be proportion, it could be odds ratio, it could be risk ratio, it could be correlation. So anything that you can calculate from one sample, that is basically statistic. So first, let me tell you about the standard deviation. Standard deviation, what it tells you for the reader, that what is the kind of variability, what is the distribution of variable in your sample, in your master chart. Say, for example, if your variable is systolic blood pressure and you have 100 individuals, so you have 100 values, but the reader cannot see those 100 values, right? So, but he would like to see what is the kind of distribution you have, right? Because all 100 values are not the same. So what is the distribution, how homogeneous or heterogeneous your variable is in the sample that you have studied, right? So standard deviation would always be in table number 1. See, in any paper, regardless of what your objective is, the purpose of there has to be table number 1, which basically describes the profile of your study participant. Because when the reader or the reviewer reads the results section, he knows that for what kind of study participants these results are being talked about, right? So the standard deviation would always be as a part of profile, essentially in table number 1. Now, standard error is a measure of variability, but it's a measure of variability of not your observation in the sample. Basically, one would say nobody knows what is the true result in the population. Nobody knows. If one knew, why will you do the study, right? So with great difficulty, one does one study. So what one is interested in knowing that if I repeat this study a number of times, what am I going to get the same result? Or if not, then what would be the kind of variability? So standard error basically tells you about what is the extent of variability in your study results that you obtain. So now for what kind of variables one should calculate standard deviation and one should calculate standard error. Standard deviation has to be calculated for all the variables that you are going to report. But standard error has to be calculated only for your study results. And your study results would be for the stated objectives. So for example, in a study, if there are 5 objectives, so one is going to calculate 5 things to address each of the objectives. Now for each of these 5 things, whatever you calculate from one sample, what kind of values you will get when you repeat the study, right? So that is what is basically what the standard error. So the standard error is to be calculated for all the results that you are going to calculate to address your objective. The standard deviation is to be calculated or to be reported to describe distribution of variable in your master chart, because the reader cannot see your master chart most commonly. So there is no place for standard error in table number 1. Now, but people, what they do is, since a standard error is smaller than a standard deviation, so they think that anything after plus minus, smaller it is, better it is. So therefore, don't report a standard deviation, report a standard error. So actually, the two have different meanings. So again, table number 1 should never have a standard error. The standard error should be calculated only for those study results which you're going to report. And this standard error would eventually be used for both the calculations for p-value, it will come in the denominator of statistic, and for calculating confidence interval. Over to you.
Thank you, sir. So it's very well explained that the standard error should not be presented in table 1. Instead, you should present standard deviation, but standard error can be used to calculate, p-values and 95% confidence interval. Thank you, sir. Now, next question, I'll go to the Dr. Prakash. Why avoiding presenting results that are never discussed? It is said that results should be presented in chronological order rather than the logical order. So what's your take on this statement, sir?
Thank you, Dr. Gayatri. At the outset, I would say that it is a privilege being a panelist with Professor Pandey and Professor Sood. And I have had a long association for close to 2 decades with both of them. And obviously, all these answers, Dr. Pandey himself is capable to answer. But anyhow, since the question has been posed to me, I will try to answer this. This has been touched by Professor Pandey as well as Professor Sood also, that whatever are the results, the study which was aimed for the primary objectives, the secondary objectives, and as Professor Pandey said, the table 1 has the demographic data and all the baseline data. So those things have to be mentioned in the results, number 1. So all data that we have collected should go to results, and no data should come afresh in the discussion section. This is very, very important. And number 2, whatever has been mentioned in the results will need to be discussed in the discussion. So this is important. So you have to avoid presenting the results that you don't want to discuss, because that means that is not related to the part of the study, or you don't want to emphasize it. I will give you a very simple example, not a surgical example, but yes, supposing we find a correlation between waist circumference and height. Now, this may have a plausible correlation, they may have a scientific correlation, but if you think that it is not important and you don't want to discuss it, then you should not mention it. Otherwise, you should, if you mention it in the results, then you should go ahead in the discussion and mention that probably we found a correlation, but yes, it may not have be a clinically significant correlation, and hence this is what, and no other study has reported such a relation. So this is important that you mention whatever results you have mentioned, even the demographic data that you have. If it is unique to your study, if you find a male to female ratio of 10:1 in your study, despite whatever sampling frame, sampling methods you had used, so that again, you will need to discuss it. Don't leave anything in the results which you have mentioned, and they need to be discussed in detail whenever you are doing, because that is the unique thing that you are doing with your study. So that is probably the first part. The second is, it is said that results should be presented in chronological. Now, incidentally, chronological is also logical and logical order is also logical. And Dr. Pandey said, table 1 is demographic data. Yes, it is pertinent that whenever you do a study, there is a tendency to jump. It is logical to have the results first and mention the results only. So you will try to mention the primary objective results, the secondary objective results, but that actually confuses the reader. As was being discussed in the last session, methods are the validity of the study. So the method section, you try to go step by step. Similarly, in the same vein, in the results section, you want to go through the same sequence of steps again. So that is how we actually proceed. You have a sample size, you have a demographic data, then you have baseline parameters like blood pressure, etc. Maybe pre-operative statistics in a particular group. So then you will come to the primary objectives and secondary objectives. So that is not only logical, but that is also the chronological sequence. So that does not confuse the reader. That actually tells the reader how you actually did the study. And during the course of the study, these were the variables that you have had. These are the demographic data you have. And these are the baseline clinical data. Then you have the study data, primary objective, secondary objective. And that is how actually you should build up. So that is my take on it. The other panelists are free to comment on it. Thank you, Dr. Gayatri.
Yeah, thank you. Dr. Pandey, would you like to say? You are muted, sir.
No, this is perfectly right. I mean, it has to be reported in chronological order, and in results section, actually you don't describe start describing profile ki bhai male itne, female itne. Those are for the reader to see for what kind of. Otherwise, your results section gets cluttered, right? So in results section, you should discuss about results. Your objective is not basically to find out what percentage are males, what percentage of female. These are only for the reader to interpret the result in this context, that for this kind of profile of participants, these results are being talked about. Yeah.
Yeah. Thank you, sir.
As mentioned earlier, I think tables, diagrams, and the interpretation, they should not overlap. That's very important. We see that overlap in thesis, but because there इससे क्या होगा कि your thesis becomes thick, but in manuscript it is not allowed. So if in any manuscript, when repetition comes, then the reader or the reviewer knows who is this person, and then that will do more harm to your manuscript. Yeah. Over to you.
Thank you, sir. So I'm skipping this because this is related to the methodology session of statistical analysis, which has been already discussed in the last session. So I'm moving to the next question: how to report the internal and external validity of the results, which is the important part of the manuscript. So Dr. Pandey, if you can say something about it.
Yes. See, for every question that one has in the study, at the end of the study, results will be provided. Now, for every reported results, 2 questions will be asked, right? And what are those 2 questions? How valid your results are, and second is how reproducible or how reliable your results are, right? And as it has been reiterated, method section is the key. Method section is the key. And that is what actually ensures whether your results are valid or not. And validity, as mentioned here, there are two kinds of validity. One is internal validity, second is external validity. So since all studies are being done on sample, then one has to really assure that my sample is representative of the target population. So if your sample that you have enrolled is representative of the target population, then the results that you get on sample has external generalizability, otherwise not. So how do you ensure external validity? One ensures external validity by adopting appropriate sampling procedure. But that is only in observational studies. In cross-sectional case control cohort, you do sampling because you have a real population and you draw a random sample. External validity is not an issue in clinical trial, because if you do a clinical trial sitting in a hospital where you have list of inclusion criteria, exclusion criteria, and consent, then the kind of patients that you enroll in your study are not representative of all such patients in the population, right? So there is no question of that sampling there. But again, results of all studies, whether observational or clinical trial, have to be generalized to some target population. Now, the clinical trial sample is not random sample, it's a sample of convenience. And the target population for a clinical trial would be a hypothetical population. And in that population, the members would be similar to the one that you have in your inclusion-exclusion criteria, not necessarily living in some fixed geographical area. So external validity is less of an issue in intervention studies. It is more in case of observational studies. Now coming to internal validity, your results will be internally valid if the reported result is same as what is the true result on the sample, right? So that you ensure by your method section. Only, so method section is most critical. Now, if you're suppose you have your sample is absolutely representative. You're doing an observational study. Sample is absolutely representative, but you have not done the study well. So once you have not done the study well, whatever results you get is not true for your sample. So when it is not true for your sample, forget about generalizability. So in research, internal validity takes the priority over external validity.
Thank you, sir.
Okay.
Thank you for this explanation. I would like to ask Dr. Sood or Dr. Prakash if they want to add something on it, though it is very well explained.
I think it is very well explained. Doesn't need any further explanation.
Thank you. Dr. Prakash,
Well,
would
it
you
is
like
okay.
to?
I think the methodology has to be robust to have these things incorporated. And I think Dr. R.M. Pandey sir has already clarified it very clearly.
Yeah, thank you, sir. It is very well explained that internal validity has to be taken care with the method section, and external validity for RCT, we don't have to worry about it. So the next question, we have already covered whether statistical approach is justified and assumptions on biased consideration. These things has to be mentioned in result section, or it has to be in the method section. So Pandey sir, if you can.
Yeah. So see, as
comment
far as bias is concerned, there is no statistical method which can correct for bias. And there is no study which is completely free from bias. Best studies have minimum bias, right? And bias is in any study generally comes at 3 stages. One is the selection bias, second is ascertainment bias, and third is analysis bias. Right? So bias has to be anticipated, and in your protocol, one has to say that what are the different kind of biases that you anticipate at different stages of your study, and what strategy or what steps you are going to take to ensure that they don't get into the study, or it is as minimum as possible. Right? Because nobody can detect, there is no way to detect measurement bias. Like if you have measured body weight incorrectly, I mean, nobody can figure out that what is the extent of error. But then you have to convince that how did you measure body weight? Because nobody knows the correct body weight of a participant. But that's where method becomes critical. Which machine did you use? How did you calibrate? And all those kinds of things, when you explain, then one knows that your measurements are valid. So you have to actually ensure your measurements are valid, then only your any result will be valid. So bias, there is no method as such. Now coming to data analysis, that is, see, in any paper, one reports analysis corresponding to whatever results in being described, but they never report what all analysis they did. So if you do 100 analysis, 5-10 results will automatically come, which will suit you, and you report those 5-6 results. That is why it is very, very critical that in the method section of the protocol, one should very clearly write what all method because you know your objective. I mean, the person knows his objective. He knows what data he is going to collect. Then he should know how he is going to summarize, right? But most protocols, what we see, that appropriate statistical method will be used using SPSS. So such protocols, they have absolute scope for analysis bias. So I think that is why all methods have to be defined or dictated a priori, right? So if it is quantitative, then one can say, okay, I'll calculate mean or median, depending on the distribution, but it has to be mentioned. So analysis plan has to be clearly mentioned. Yeah, over to you.
Yeah. Thank you, sir. Thank you, everyone, all the panelists. I'm getting reminders that we are running late. So I will wrap up with the few points. Dr. Sood has well explained the do's and don'ts about the results section. Dr. Anupam Prakash has correctly said that chronological and logical are the almost same kind of thing. You have to choose wisely how you are presenting results, and internal and external validity, and how to report where you have to report. Most of the time you have to report standard error instead of standard error of mean, because that has to be used to calculate the precision and p-values. Thank you, everyone. I'm moving to the next session.
Yeah, just a parting comment. As Dr. Pandey rightly said, that most of the surgical studies, they are inflicted with the selection bias. We already know that what kind of result a particular surgery is going to have. And this has a lot of, impact on the generation of the data and the results. We already know what kind of result it is. So especially senior people are inflicted with this kind of bias. Thank you.
Yeah, exactly. Exactly. Thank you. Thank you,
Thank
everyone.
you. Thank you so
Yeah.
much.
So we request you all if you can stay with us for the activity session there, because that is based on the statistics, more of the statistics. So we can have some question answer session on this. So our next session is writing the discussion and an effective conclusion and key messages, which is nowadays journals are asking that you have to bullet points some key messages what your manuscript is going to. So we have among us, this session is being moderated by Dr. Sasinder. Dr. Sasinder is orthopedic surgeon, and his area of specialist is arthroscopy and sports medicine. He is specialized in shoulder and knee orthoplasty, and he's a professor of orthopedics in Sri Lakshmi Narayan Institute of Medical Science, Pondicherry. He's a fellow of International Society of Orthopedic Center. He's a fellow of Cartilage Reconstruction, UK. He's a vice chair of JCOT Education Committee. He's a member of Knee and Sports Traumatology Society of JCOT. He is also member of IODA Membership Committee. He is honored member of SLARD, deputy editor of JCOT, section editor of IJO, assistant editor of JO, and section editor of JASSM. Over to you, Dr. Sasinder. Thank you.
Good day, everyone, and thank you, Dr. Gayatri, for the introduction. I thank Dr. Chabra and the JCOT team for giving this wonderful opportunity for me to moderate this session. So, my session is on an important part of a research presentation or publication, that is discussion. A research paper cannot be complete without a good discussion. We can have wonderful results, but if the discussion is not projecting the results as to what is the importance of it and how it can be projected to the general population and how the clinical practice can change depending on the results, then the study is not useful. So a wonderful discussion is a definite must in a publication. And I have wonderful panelists with me to discuss about this. First, let me introduce Dr. Karthik Vishwanath. Dr. Karthik is professor and head of orthopedics at Parul Institute of Medical Sciences, Vadodara. He is honorary senior lecturer at Wrightington Hospital. He is also on the editorial board of JCOT, JOO, Indian Journal of Orthopedics, Journal of Arthroscopy and Joint Surgery, and is also editorial board member of Apollo Medicine. Welcome, Dr. Karthik. Then we have Dr. Mohit Kumar Patralek. Dr. Mohit is Chief Medical Officer and Orthopedic Surgeon at Central Institute of Orthopedics at Safdarjung Hospital. He is also Deputy Editor of JCOT and on the editorial board of Indian Journal of Orthopedics, Journal of Orthopedics, JAJS, and a lot of other journals. He has got a lot of experience in publications. And then we have Dr. Rajiv Tukral. He is Director of Orthopedics and Head Joint Replacement Program at Metro Heart Institute, New Delhi. He is also on the editorial board of JCOT, Indian Journal of Orthopedics, and a reviewer at multiple other journals. He also has immense experience in publishing international papers and index journals. Okay, let us move on to the discussion. I will try to make the discussion as simple and clear as possible with very simple questions. First question is for Dr. Karthik. Dr. Karthik, can you please give in short, what is the purpose of a discussion in an original article? What is needed? What should not be missed?
Thanks, Dr. Sashi. So discussion is the main section of the paper. It reflects your the intellectual component of the paper. A poorly written discussion means it is probably going to be as a definite rejection. While if it is a well-written discussion, there is a good chance, provided that the other sections, mainly the methods and results, are okay. There's a good chance that the paper is likely to be accepted with some revisions. Now, when we are writing a discussion, the most important thing, the crux of the discussion is, what is the work contributing to the existing knowledge? What are the gaps in the knowledge, unanswered questions, which should have been mentioned in the introduction section? The discussion component of the paper should answer those things. There should not be any repetition of what has been mentioned in the introduction, but it should be answering those gaps. The findings, the main findings in an original article should be mentioned, but there should not be any repetition of the figure, the numbers and the results. What is novel? What is the clinical relevance? Is it going to change clinical practice? These are the sort of questions which should be addressed in the discussion section. The third important component is comparing the work with previous publications. How are the results different to the previous work? Why are they different? That is the most important thing. Why, and why is it different? And what are the possible causes? Right? If you get reference to support your point, that is well and good. Otherwise, your thinking is also fine. Why your results, when the results agree with the previous work, there is not much change, but when it disagrees, I think that is the most important thing. So again, this should be an honest acknowledgement of the strengths and also the limitations. So this is the main crux. In short, this is the main section of the manuscript, which is really going to draw attention and is going to decide, like is it going to be an acceptance or a straightforward rejection or what? Over to you, Dr. Sashi. Thank you.
Thank you, Dr. Karthik. The next question is for Dr. Mohit. Dr. Mohit, how are the discussions different in a case report and in an original article or a systematic review? Can you please guide in brief how the discussion should be taken forward in these scenarios?
Hello, thank you for the question, sir. Sir, so we have three different types of articles here: original article, case report, and systematic review. So as was being discussed in the previous section, that on Equator Network, guidelines are available for each type of manuscript. So for case reports also, there are care guidelines, and for surgical case reports, there are care guidelines. Similarly, for randomized control trials, there are consort guidelines, strobe guidelines for observational studies, and for systematic reviews, we have PRISMA 2020 guidelines. So as far as possible, we should try to adhere to the guidelines. So starting with the original article in general, as we know, as was being discussed previously, the purpose of any discussion section is to place our findings in the context of the literature already available. So in the first paragraph, we just summarize our research and answer the research question in a straightforward manner in an original article. Now, it is important to note that discussion section is usually the most lengthy portion of the manuscript, and it is easy for the readers to get bored if it is not planned carefully. So usually there are 6 or 7 paragraphs, and each paragraph has 200 or something like that words. So there are 1200 to 1400 words in the discussion section itself, usually. So for writing the next part of the discussion section, which is the main portion of the discussion section, we usually go by a divide and conquer approach. By that I mean, we look at the results section. Every study, original study, has a number of variables. For example, if an author is comparing one approach with some other approach for addressing an articular fracture, for example, there are different approaches for the elbow, different approaches for approaching stabular fractures or like that. So we study the adequacy of the approach, the quality of reduction achieved, the blood loss, the surgical duration, and finally the duration of stay in hospital and functional outcomes. Some studies also include a radiological component. So for a discussion section, we pick up each of these variables separately, which have already been outlined in the results section. But in results section, we place our results directly, either in tabular format or in language in the results section. Here, we need to interpret our findings in relation to the literature which is already available. So we record our findings and we try to interpret how does it affect the evidence how does it affect the evidence which is already available from the work done by the previous authors, and what impact does it make on the clinical practice, on the surgical practice in particular, on the what type of surgery which may be adopted by the surgeons, what is our recommendation for that, and does it have any implication for the policymakers, or does it have any economic implications? We can, a little bit of speculation is actually allowed in the discussion section. So for each of these components, we need to highlight. Suppose considering the blood loss, so we can say this much was the blood loss encountered by us in this group and in this group. But how was the blood loss measured by us, and how does it compare with the techniques for measuring or estimating blood loss which was used by other authors? And if the blood loss was particularly high in one particular case, why was it so? What was the difficulty encountered in this case? How does the blood loss correlate with surgical duration? So we can correlate the variables among themselves also and look out for reasons for those correlations. Okay. So coming to case reports, in case reports, we just discuss only one case or maximum two cases. So here, so we have, as I have already indicated, here we have care guidelines for case reports and care guidelines for surgical case reports. So again, as in an original article, we just provide a general interpretation of our case, but here we need to include the strengths and weaknesses of the techniques used by us for managing the particular case. So in case of a surgical case report, suppose we are discussing a new technique or we have come up with a new implant, we should also try to say what are the potential contraindications for our new implant or our new technique, what are the alternatives, and what are the possible complications, because we have studied the case, studied that particular technique in just a few on one patient only, like that. Or if if we are reporting an adverse event, have we reported that event to our national agency or the pharmaceutical company if we are reporting a drug adverse effect? Similarly, as in the original article, we should place our case in the context of the literature which is already available, and how will our case impact the clinical practice guidelines. And no interpretation, no definite conclusion can be derived from a case report, but still will it help in making any new hypothesis, and can any new study of higher methodological quality be started on the basis of this case report? So we speculate on these aspects. And finally, while drawing a conclusion, as I have already said, any firm conclusion cannot be drawn from any case report, but still we need to provide the rationale for our conclusions and any takeaway messages. So this was basically the crux of the care and care guidelines for case reports. Similarly, for systematic reviews, we have PRISMA guidelines. So for systematic reviews, in the first paragraph, we provide a general interpretation of the result in the context of the other evidence which is already available. And we need to discuss the limitations of the evidence which is already available. It means we need to consider each individual primary study. We need to discuss each individual primary study and look for any risk of bias or methodological quality issues in those studies. Okay, and then once we have done that, then we should again come up to our review, review and discuss any methodological limitations in our review process. For example, if we have considered only English language studies, or if we have looked for studies in only one database, like that. And finally, we should end with a message for clinicians as well as for the policymakers. So thank you.
Thank you, Dr. Mohit. Thank you for the detailed explanation. Dr. Rajiv, can you formulate a simple flow chart to structure a good discussion in any research paper?
Right. Thanks, Sasinda. I hope I'm audible. Am I audible?
Yes, yes.
Okay, all right. So just as we've heard throughout the day that we need to be very, very precise, concise, and clear. Similarly, for a good discussion, as the points have been put out already by Dr. Mohit and Dr. Karthik, the idea is to actually analyze whatever data that you have got. You have followed a good methodology, and following that methodology, you have got results which you have presented in your results section. And now you want to show what that data actually means. So the first few paragraphs, the first 1 or 2 paragraphs, depending upon how long you are sort of going to write this discussion session, should focus on actually the analysis of whatever data that you have actually got in the results, and try to get some key points out of that data. And obviously you need to reference it to whatever statistical analysis method that you used, so that you can actually back up what you're saying in your discussion section about your data, the analysis of your data. So that's the first 1 or 2 paragraphs. The second part, that's the main body, is actually to compare your results with what is already published in literature. So the first part I told you is analyzing your own results, presenting key points. The second part should be comparing your results and the analysis of your results with what has already been published in literature and what they have stated in literature by their studies, and whether it matches or it is in contradiction to what your results are, because you need to actually show both sides of the coin. And once you do that, then you will be able to actually talk about some unusual findings in your study, which may actually change or make your study more significant, or may have caused limitations to your study, which you must also highlight. So this all comes in your second part of your the discussion section. Now, essentially, the whole idea of discussion is to come to a conclusion. So the third part has to be when you actually summarize all of this. So you start off by summarizing what your hypothesis was, in brief mentioning your methodology and the results, and then whether you actually achieved what you set out to achieve in the study. You highlight whether it is clinically significant, whether it has any impact on practice, whether it is going to actually, say, give rise to further studies or fuel further research. Does it give you some more questions that you have to answer? And if possible, come to a conclusion. Now, all of this obviously should be in a very, like you've heard before, logical and chronological method. But the idea is, in brief, it's difficult to do this in brief, I understand. But the idea is to first present the analysis of your own data. Second, compare to what is already existing, along with any sudden or unexpected findings, and eventually come to a conclusion from whatever you've done in your study. So that's your flow chart.
Thank you very much, Dr. Rajiv. Dr. Karthik, can you tell us what are the most common mistakes when writing a discussion, or in other words, how not to write a discussion?
Thanks, Dr. Sashi. The key points in what not to do in a discussion are repeating the numbers that you have already mentioned in the results section. So here you're supposed to discuss, instead of again repeating numbers like, oh, there is a difference of 4.42 mean and all those things. It's better to say, what is the significance? What do you interpret? What do the readers interpret? That is what you have to take care. Don't repeat the knowledge gaps which you have already identified in the introduction section, because that is the key, right? And how your study has addressed, that should be mentioned. Also, it is better to avoid doing a lengthy review of published work without actually mentioning what is the relevance of that work to the present work. So, for example, if you are looking at fluoroscopic exposure for an IT fracture, if that is the aim of your study, then there is no point of mentioning the union time, the hip outcome scores, and all those things of the included studies. So it's just important to remain focused and only talk on relevant things. So this commonly, this fallacy can happen when we are trying to convert a thesis of a postgraduate dissertation to a paper. So it's very important to be precise in what you're trying to answer. Don't include literature that is not directly related to the present study. Just for increasing the number of references, it is better to avoid that. One of the biggest things of what I see when I review papers is people talk only about statistical significance without actually dwelling into the clinical significance. So let me give an example. If there is a difference of 2 points in the Oxford HIP score between two groups that you're comparing, for example, one has had DHS, the other one has had PFN, and if the study shows that it's a difference of 2, right, and it is statistically significant, but when you look at the minimal clinically important difference value of Oxford HIP score, it's just far more than the number 2. So actually, so it is important. The study may show that there is a statistically significant, but you may interpret that there is no clinical significance because the value is so small that it is less than the measurement error which is possible to be examined by that instrument. So that is what should be a key thing. Again, don't avoid, it's better to avoid only mentioning the strengths of the study. People always try to shy away from not mentioning limitations. It is better that you acknowledge honestly all the limitations of the study, because as one of the previous speakers said, none of the study is going to be without bias. There is always going to be some bias, some shortcoming, some limitation. What is important is to mention how you tackled it. And again, here where the methods is very important. Like if you're going to take consecutive cases, you're going to take, if you're going to exclude, make that, a priori, that we are going to exclude these sort of patients. Again, sample size and hypothesis have to be made a priori. And then in the discussion section, you should say, oh, our hypothesis is confirmed, or, our study negated our hypothesis, and why did it do so? So all those things are very, very important in the discussion section of the paper. Thank you, Dr. Sashi. Over to you.
Dr. Sasinder, you are muted.
Yeah. I'm sorry. So the final question to Dr. Mohit. How to write an effective conclusion or summary?
Thank you, sir. So the purpose of the conclusion section is to give a take-home message to the readers. So in this section, we just summarize whatever we achieved from the study in a line or two, and we should not do it very boldly. We should always acknowledge our limitations. If it has been done earlier, again, we should frame our sentence in such a manner that it does not look very bold. We should only write what we have achieved. And it is while writing a conclusion section, one should take care that no speculation or wandering away is allowed. One should be very strict in mentioning only the information which we have received from our study and nothing else. Okay, and then we should make recommendations regarding future research. For example, if we see that there is a paucity of prospective studies or randomized controlled trials in this area, in this particular area of research, we may mention that. And in brief, we may mention implications of this research, or we can say make some recommendations for clinicians as well as for the policymakers. But again, one should be careful not to make any recommendation which is not based on the evidence which we have gathered on the basis of our own original study. Or if we are conducting a systematic review, we should strictly base our recommendation on the evidence which we have summarized here. Okay. So for example, if we have not conducted any cost benefit analysis or cost effectiveness analysis, then we cannot say a word about, cannot say anything about the economic implications of the research. We might know that one particular way of treating a patient is more cost effective or cheaper than other, but we should not come out with these things in the conclusion section. Some amount of freedom is allowed in discussion, but conclusion should be very crisp. Its purpose is just to give a takeaway message and the implication in the context of the present literature, and finally recommendation for the future research if necessary. Thank you, sir.
Thank you very much, Dr. Mohit. So I would like to wrap it up. I would like to say that discussion is one place in the research paper where you can actually write your mind down. Other than your research question, the discussion is the place where you can write what you think. But however, it has to be logical and it has to be backed by evidence. The evidence can come from the same research, the current research paper, or the literature available so far on this particular topic. But also, the discussion is one place where the author can become very biased, knowingly or unknowingly. It is possible to say some particular technique is the best of the technique, and it's also possible to say the particular technique is the worst of technique and back it up with literature. We could have both, but the authors should make it essential that he balances the available literature and tries and uses the highest level of evidence when making statements out there in the discussion. So it is essential to be unbiased, and it is also essential to project or show the clinical significance of this particular paper. It is absolutely not useful in the clinical scenario if you are not correlating it with the clinical significance. And then finally, in the summary, as Dr. Mohit said, it is possible that oftentimes it's seen that the author becomes over enthusiastic and starts giving statements. The study will just be about a prospective clinical outcome study, for example, of arthroscopic hamstring reconstruction of the ACL. However, that he could put a statement that hamstring reconstruction is better than patellar tendon reconstruction. This is not what exactly the particular study did. So don't make any statements in the conclusion that have not been specifically studied in that particular paper. However, you could give guidelines as to further possible research that could be taken, which could be carried on as a starting point from this particular research work. I hope this clarifies most of the things about discussion and conclusion.
Could I add something here, if you don't mind?
Raju.
Yeah. So as Dr. Mohit and as you, Sasinder, have just stated, one cannot give a recommendation based on the results that you have got from one scientific article, which is say an original case series or whatever. But if you have a study which is done systematic data analysis or a review of multiple studies and multiple centers, then you could actually, like you said, provide guidelines only. So as a conclusion, it's never possible to say with certainty in a single series or in a original article, but with a scientific, systematic data, you can actually provide guidelines again. And then you could say that you want to eventually have much more of this analyzed and then presented as, a white paper or something like that. So that's what I would add. I was trying to add, that's all.
Yeah, thank you very much, Dr. Raju. Thank you, everyone. Over to Dr. Gayatri.
Thank you, Dr. Sasinder. It was a wonderful session on the most important part of the manuscript writing discussion, because analysis is a little simpler if they can have some knowledge about the softwares and they have access to experienced statistician. It can be done, but the discussion part is the most important, and most of the time young authors and people suffers about it. Thank you so much. Thank you all the panelists for the wonderful discussion. Let's move to the last session of the day 2, that is activity, which we have already sent to the participants, and the participants have already sent their responses. I have to announce the winner, so please stay tuned with us, and I'll request all the panelists, those who can be there to answer, if they want to add something on the questions, they can. And I request again on this activity part, those who are watching us live, they can log into the OrthoTV and they can post their questions or any suggestion on the chat box, and we will address here. So I'm sharing the activity slides now, which was on some of the main results section part based on some of the statistics. This was the first question which was asked the participants, that when and want to use, because that is the most important thing. Generally author get confused, especially the clinician and young researcher, what to report. And we have already discussed this question during our session. And the best answer I have highlighted in the circle that people have written, that yeah, it is standard deviation is the descriptive measure, while standard error of mean has to be used to calculate the precision. The second question was on the two groups. That means if you are analyzing two groups, treatment and placebo, they are compared as a continuous outcome, let's say skim score, using an independent sample t-test. What statistical parameter should be reported in the publication as in the results section? So people were writing, these are the answers which I have just put it here as a screenshot. And the answer for this has to be, you have to report the number of sample size, like that what you are analyzing for that particular thing, because sometimes what you are quoting as a sample size, that is not achievable at the end. So you have to mention the observation, then your mean of the outcome, standard deviation for both the groups. Then you have to report the mean difference with 95% confidence interval and the p-value. T-statistics, some people are writing T-statistics, which is not required, I think, if you are mentioning the effect size and the p-value. The question number 3 was, what all statistical parameters should be reported for differences between the groups on a binary outcome, let's say recovery rate, or whether a person has a recovery, yes and no. So people have responded on odds ratio and relative risk, number of participant and categories, chi-square test, and some people have written yes. So the answer to this question will be, the difference between the groups on binary outcome can be expressed as the absolute difference in the proportion of the subjects with a specific outcome, for example, the success intubation. As a proportion can be viewed as the estimated risk of having a certain outcome, that is the risk difference. Alternative, people may use risk ratio or odds ratio, which is commonly used. But if you have the binary outcome and you are comparing with the two groups, you have to present the numbers. That means in terms of events for both the groups, relative risk or risk ratio or odds ratio, whatever you are thinking, it is good to represent. It depends on the study design as well, what it's a prospective or retrospective design. And then you have to report 95% confidence interval for the odds ratio and with the p-value. So next question was on the what is an effect size and how to report it. So we have got couple of answer for this. People have written very well about the Cohen's d. But for answering this question, I will request Dr. Pandey sir, who is the expert in this field, if he can say something about it on the effect size and how to report this. Are you there, Dr. Pandey?
Yeah.
Yeah, sir.
I think most of them, they have written correctly. See, effect size is nothing but the difference in outcome between the two groups that you have, and so that's what it is. If your outcome variable is quantitative, then it will be difference in mean. If your outcome variable is categorical, then it will be difference in proportions. If your outcome variable is time to an event, then it will be a kind of reduction in hazard rate. So that is what will be your effect size, and for which you report 95% confidence interval. Yeah.
Yeah, thank you, sir. Anyone else in the from this panelist who want to add anything on this? Oh, okay. Let's move to the next question, which is how is the p-value reported in a journal? So we have got several answers with the different thing, like we have to report 0.05 and some other thing. But what I think it depends on the journal. Journal itself is having their own guidelines how to report. Some people write capital P italic and then dash value or something. And How to report it? They issue their own guidelines. So it is always suggested that author has to read the guidelines carefully before submitting the manuscript. They have to change the reporting of p-value. However, there are some certain standard to report the p-value. For example, you have to report the exact p-value. Instead of writing p-value less than 0.05, if you can write the exact p-value, that is always good, even if it is highly significant, instead of reporting 0.00, because generally software gives 000, which is having no meaning. Instead, you can report less than 0.001, and it is always good if you are reporting 3 decimal places. But this is my thing. I request again Dr. Pandey sir or other panelists if they can add something on this, how to report the p-value in a journal.
Yeah. Now actually most of the journals, they are saying report the exact p-value, because p is equal to 0.04 and p is equal to 0.01. Both are less than 0.05. But these two values, p-values are different. So they say report the exact p-value and let the reader interpret depending on whatever the p-value. But very common mistake what we have seen is that for any analysis, some computer software is used. And if the difference is very significant, then you get p is equal to 0.0000. Then it is reported as p is equal to 0.0000. Actually, it is p-value is always non-zero, because your output is formatted only up to 4 digits after decimal place. So there is some non-zero number, so it should be converted into less than 0.001. Instead of 0.0000, you will get p is equal to 0.0000 only when you study entire population. But one never studies entire population. So that is a common mistake that we see in many published papers.
Yeah, thank you, sir. So the next question was just only 2 questions. We were having multiple choice question because I thought that people will write and they will get frustrated with lot of statistics. So it is just only case study has been presented that which statistical test an author should be reported. So the study was to compare 2 groups. 9 of them male were randomly selected to the one treatment group, another was on placebo group, and most of the answer were correct. 75% participant had said correctly that independent sample t-test for mean has to be reported. Yeah. And the last question of this activity was again on the case study, that which statistical test they should report. It was on the students were given different drug treatments before revising their exam. Some were given the memory drug, some were placebo, and some are given all treatment, no treatment at all. So the control group. So there were 3 groups to compare, and 75% again participant has given the correct answer that one way ANOVA has to be used to analyze this kind of data. So thank you so much for this. Now I am going to announce the winner for the activity, this activity. And the first winner of the activity is Garima Wadhwa. Congratulations, Garima. The second position secured by Kajal Goyal. And the third position secured by Mona Al Saad. So thank you everyone for participating. All the participants are the winners because they have participated enthusiastically, and congratulations to all and the winners. Thank you. Now I am wrapping up this session and would like to introduce our next member who is the Secretary of DAO Society. I hope you can see my screen. I have shared a screen. Dr. Shekhar Srivastava. He is the Chief Surgeon. But I'm getting some. I hope the screen is visible. I'm getting some message from Zoom quite unexpectedly.
Gayatri, we can see the screen. Please go ahead.
Okay, yeah. So he's a chief surgeon and head of joint replacement surgery at Delhi Institute of Trauma and Orthopaedics in the St. Paramanand Hospital, Delhi. He's more than 25 years of experience in joint surgeries and has expertise in fully automated robotic surgery. He is a secretary of Delhi Orthopedic Association. He is going to give some validatory remark. Over to you, Dr. Srivastava.
Thank you. And can you hear me?
Yeah, we can hear you, Dr.
Yes, sir.
Okay. So I was listening to the webinar, and it was I was really amazed by the
Your voice is breaking. Sorry, Dr. Srivastava, your voice is not clear.
Maybe you could switch off your video, Dr. Shekhar. Dr. Shekhar Srivastava, you could just see if you could switch off the video and speak.
Okay. Can you
we can hear you.
Can you listen?
Yeah.
So this course is much sought after, and it's a very popular course, and the whole credit goes to and the team of JCOT who have been conducting these courses. And DO is really proud of the way JCOT is coming up. And on behalf of the Delhi Orthopedic Association, I would like to thank all the faculty. The content of the course is helpful not only for the young authors, but also for the experienced ones. So once again, I would like to thank the whole faculty and especially the editor-in-chief, Dr. Chavda, for the course. Thank you.
Thank you, Dr. Shekhar Srivastava. Thanks for joining. In fact, we are thankful to Delhi Orthopedic Association for the opportunity to all of us. So on behalf of the editorial board of JCOT and the various committees, and especially the training committee, which has put up the show today and last Sunday, I would want to thank you for being there with us today, and for Delhi Orthopedic Association for the opportunity. And before handing over the mic to Gayatri, I would also want to thank all faculty and all participants for a wonderful event today and last Sunday. And we'll look forward to having you with us for the subsequent webinar as well. Do contribute towards JCOT in whichever capacity you can, either submitting articles or acting as a reviewer, or trying to climb the ladder to the editorial board. So look forward to your wholehearted support and contribution. Thank you. Over to you, Gayatri.
Thank you, sir. Thank you. I would like to thank all the members of training committee who is inspiring me for conducting this thing, and the chair of this training committee is Dr. Alok Sood. He is always available for any kind of support. And I'm happy to announce that more than 400, I think 435 people were watching us on live on OrthoTV. That is a great number. Congratulations to everyone. Thank you. And we will be doing this kind of webinar and looking for your support. Thank you and have a good night. Thank you, everyone.